The Career Pathways for Racialized Newcomer Women Pilot, a 4-year pan-Canadian national project involving 8 service providers, established a formal community of practice among its practitioners delivering interventions. The goal of the project is to test 4 models of employment services to support racialized newcomer women in finding good quality employment. The community of practice effectively united practitioners across its partner organizations, facilitating exchanges of ideas and practices, mutual learning, and collaborative problem solving. What is a community of practice? Simply put, communities of practice are groups of people who share a concern or a passion for something they do, and learn how to do it better as they interact regularly. The pilot brought together participating service providers who shared a common goal and passion.
We all share a sense of common purpose, and even our method and the views are slightly, sometimes, different, right? Different from each other. But our ultimate goal is to support racialized newcomer women, to overcome existing barriers, and find the good place in the Canadian labor market and in Canada.
Why are communities of practice important? Communities of practice are important professional learning strategies. Among many possibilities, they have the potential to connect people who might not otherwise have the opportunity to dialogue, interact, collaborate, and learn together and from each other. Build evidence by providing a shared context for people to communicate and share information in a way that builds collective understanding and insights. Enhance practice by providing a forum and process to share and learn promising practices and identify solutions to common problems. Address complex problems that require more implicit knowledge, which is better shared through conversations. Generate innovation as new ideas come from diverse collaborative networks. What did the Career Pathways for Racialized Newcomer Women Community of Practice look like? The Career Pathways for Racialized Newcomer Women Pilot established a community of practice to bring together the service partners, researchers, and the funder to learn with and from one another about what was working well and what needed improvements, and to share promising practices. The community was formally bound by their participation in the pilot and their shared expertise and passion for supporting racialized newcomer women in finding good jobs.
Because this project was also part of a national initiative, we had the opportunity here at Mosaic to meet other organizations, to learn about other programs across Canada. And those organizations, those colleagues in other provinces, we continue to engage with.
The community's activities included a blend of regular face-to-face and virtual meetings, peer-to-peer sharing, learning opportunities, and community building throughout the project. Furthermore, these activities were designed to be engaging, foster creativity, and facilitate collaboration. Benefits for service partners in the Career Pathways for Racialized Newcomer Women Pilot. We asked members about the value the community of practice brought to their intervention, practice, or organization. All agreed it was valuable and a positive experience. Some benefits include information sharing. Members learned about program delivery experiences across different interventions, including issues, which helped enhance program effectiveness. It was also reassuring. Service partners realized that other partners were also experiencing similar challenges. They were able to learn about what others were doing, and to get help from other providers.
Just meeting people from the other organizations, but in the same sectors, under the same project, it just itself is amazing. We all, again, we are like-minded people, and we share our program overview, program outcomes and challenges, and also possible solutions, and many more. Also learning from each other.
The discussions we had within the CPRNW community of practice were useful to compare the challenges each project was experiencing and share what was working and what was not. This space also enabled us to discuss potential future interventions where we could join forces. There was something new to learn every day. It was about how we can do this better. Those meetings were a great opportunity to share resources. The roundtables in particular were a space to collectively address some of the questions we had as service providers. It was a great way to brainstorm and to listen to what other providers have implemented as best practices.
So this project, by bringing us together, it allowed us to share insights, share best practices, learn from each other. It also gave us the opportunity to look at different models that were being implemented for different groups of racialized women across different provinces. So, for example, I learned a lot from the group that was implementing the program for refugee women. We had not done something like that in Ottawa, and I thought that was a neat model with a specific focus on a specific group of people, very specific interventions.
I think the variety of ways of engaging with staff was varied, effective, and it was unique. And I think just having those connections supported us in doing our work. There was a couple of online forums and presentations, and I was able to present at one, and it was really wonderful to be able to share what we're doing and to reflect on our lessons learned as well. I loved it, and I had the opportunity at the beginning of the Career Pathways project when we were being trained on the essential skills assessment, which several of the models are using. That was really wonderful to go in person and to learn with other agency staff that would be utilizing that assessment.
The community of practice also helped develop and improve knowledge and programming through collaborative learning.
This was the first time I had experienced a program bringing forward to us as practitioners the theory of change and a strategy in terms of empowering us as leaders and our staff to understand the deeper issues that racialized women face. In my experience working in the settlement sector, no one had ever done that before. They assume that we come in to do a job and we just do it. Understanding the background and the research which SRSDC have done already on visible minority newcomer women, and having privy to that knowledge, it empowered me, and I'm sure it empowered others within the community to understand the main issues.
There was people that we met through that project that allowed us to then work together. The initiative itself incorporates learning that we gained about working and supporting racialized newcomer women, and dare I say, gave us opportunity to improve upon the current programming and into future programming.
Staff from interventions that joined the pilot later were able to learn from established programs, gaining tips, advice, and knowledge.
Actually, I'm really thankful for the community of practice. It was terrific to have it because from the very beginning, when I started this program, I think we jumped in a little bit later in the game, and we had the forum right away. So for me, it was like, okay, I was just grasping everything and learning from everyone, learning from different models, learning for the different approaches, seeing how creative people were in terms of, that is a very interesting approach, right? So I was still perhaps in an advantage in the sense that, I haven't started. So now I'm like having all the great ideas already that are like being trying, and I can decide what to implement and how for example, with OFE, we really were picking their brains and coming to them and say, okay, so how are you doing this? How are you doing that? Asking questions, bouncing back ideas. That was from the receiving end, but also we had the opportunity to be on the giving end when Achieve was also implementing their program and they were having some challenges. They also come and ask us, and it was great to now be on the other end and say like, well, this has been working well, this has not been working that well, and be transparent. I feel like sometimes in the nonprofit, we may be so guarded with each other because at the same time, sometimes we're competing with each other in terms of funding. So it's like, do I really want to say this or not? There was nothing of that in this community of practice. We were like very open and transparent, and I love it.
Practitioners mentioned how the research brought learning of how evaluation can be incorporated and used accordingly. They gained a better understanding of the importance of systematically collecting participant data and of analysis, and how to use the resulting evidence.
For the rest of world skills, our leadership influenced how managers started reevaluating what they were offering. So, for example, data analysis was something we always struggled with, right? But through the community of practice and through also the way the program was designed to capture information, we were able to share that with the rest of the organization. And there have been many modifications internally to ensure that the outcomes of clients, the interventions they're receiving, are properly mapped out and tracked so that we can tell the story based on the client's experiences.
The community brought together organizations that were new to each other. The connections formed led to collaborations and the generation of new ideas and opportunities.
We've actually, on other initiatives, have gone together and proposed other services or incorporated best practices from one province into here in BC. So those collaborations will continue to reap benefits for I think for years to come. And I don't know how to measure that other than to say that our partners have really increased through the relationships that we've gained through this national project.
The networking in the community established trusting relationships and saved time.
Here at Mosaic, we're very supportive of partnerships. Much of what we do is done through partnerships. But partnerships, like any relationship, takes time. And because of the national partners, over time we got to know them. We realized where we have common missions and values, where we have common priorities. And then when opportunities come, we don't need that time to say, is this the right partner? We've already established that we are of like mind, and it makes proposing new programming, affecting change so much easier because we have that established relationship and established trust.
The community supported its members with challenges and improved programs' abilities to respond effectively to issues. For example, programs were initially delivered in person but shifted entirely to virtual delivery when the pandemic began.
The collaboration that was built in this project and has been inspired and encouraged by the format and the structure of the project play a big role, especially during the, like I mentioned, unprecedented time of the pandemic when previous experience and knowledge was no longer applicable. Sharing ideas, best practices, and learnings with project partner organizations was so helpful and important. We were learning from each other and improving processes that supported our participants and the research. Another example of productive collaboration was sharing our experiences in regards to transition to remote services provision and back to in-person to ensure there is no negative impact on participants and the services are offered without interruption in a professional and user-friendly way.
Expand professional networks.
for professional development purposes, I mean, we were all able to grow our network and meet other service providers and people engaged in the same project who had a shared vision. But I think the relationships that we built were long, like life lasting, you know. So any project I go into, say in the future, personally, I know I have new colleagues, new people in my network that I can reach out to across Canada. And that's really wonderful and unique and important, because more and more service will be online and maybe will service, you know, clients in multiple provinces.
Why was the Career Pathways for Racialized Newcomer Women Pilot community of practice successful? Communities of practices have been around for a while, but they are difficult to build and sustain. Communities of practice require a coordinating body to thrive. Unite diverse members and guide them towards shared goals. The researchers at the Social Research and Demonstration Corporation played this role by facilitating and supporting the Career Pathways for Racialized Newcomer Women community. SRDC empowered members with resources to convene and collaborate together, fostering their development and success. Practitioners shared what made the community of practice in the Career Pathways for Racialized Newcomer Women Pilot successful and thrive.
We have the same goal, and that goal was very concrete. So we were part of a pilot, and we wanted the pilot to succeed. Yes, I know that there has been other community of practice going around, and I can see the participation fading away, but I think it's just because there is not a clear and concrete, this is what we want to achieve together.
We were all proud to serve this population of women and to see the employment outcomes that the programs were producing. I think it is a common thread that got us all together. We were all very engaged into our respective programs, and I felt very empowered when we were sharing ideas and best practices. It was a source of ideas and solutions that we could customize to the needs of our respective program participants.
During the forums that were conducted at the beginning, and there was so much transparency as well in this project about how other projects were doing in implementing and reaching their goals. So, and that allowed us to see that we had common goals versus any kind of competition that we could assume. And also the project only benefited from this complex structure because we all understood that we wanted to learn how each of the models could work for different demographics, because racialized newcomer women is a very diverse demographic, and we needed to understand who exactly these different models served best.
The way the community of practice was facilitated ensured that everyone was involved. And by that I meant, the word I will use to describe it was this community of practice was an inclusive model to take into account the experiences of service providers and to work along with what was coming out of the community of practice. So by going to the community of practice, I felt like I belonged to a community that was doing something which was much bigger than what I alone could do.
The commitment level was there. The engagement was there. I think that's what stands out to me as well. And it's really, again, when you're working with that level of professionals and people who have their heart into it, who have the skills and the resources, it's phenomenal.
Fellowship of the Ring. Fellowship of the Ring from the Lord of the King, like Lord of the Ring. Like I actually would like to put this way: we are like Fellowship of the CPRNW. Okay, different missions, different interventions, but we have the same goal. We share, the common purpose.
The Career Pathways for Racialized Newcomer Women Pilot has demonstrated the effectiveness of its community of practice framework in organizing productive gatherings to share, acquire, and cultivate knowledge and expertise, crucial for the project's success. This community of practice helped its members enhance practices and interventions, address challenges, develop skills, and foster innovations and collaborations. Through open collaboration, members contributed to building an evidence base aimed at better supporting the integration of racialized newcomer women into the Canadian labor market. Communities of practice are essential in a dynamic settlement sector and other environments, due to their role in fostering continuous innovation and skill development. They directly contribute to generating value and improving performance outcomes.